In Area 1, we discuss a few key strategies to help you prepare to engage in conversation about substance use and prescription medication misuse with your adolescent patients and their parents or caregivers. Meeting privately with adolescent patients is recommended by the American Academy of Pediatrics, or AAP, and is generally supported by parents and caregivers. Consider your patient's age, stage of development, and comfort level when deciding whether or not to meet with them privately. Explain your policy on confidentiality and its limits. For example, explain that you will have to break confidentiality if you believe your patient or others are at risk of serious harm. You may also want to let them know that you will provide an opportunity for your patients to self-disclose to their parents or caregivers before you talk with them. Most states' confidentiality laws allow private conversations between clinicians and adolescent patients. In some jurisdictions, however, parents or caregivers are legally entitled to medical information. Your professional association may have guidelines about privacy and confidentiality.
Yeah, well, I think it starts before you even see the family with, if it's a new family, having a handout so that they read, in this clinic, we always spend a little time with your child alone, just so they have that in the waiting room before they actually even get into the room, or online if, there's an online system. So then at least, they know that there's probably a period of time when you need to step out, and it's completely normal, doesn't mean anything's wrong with your child, but it's important for the care of your teen. Then when you get in the room and the first time you go through that and say, it's very important for developmental reasons, so your teen learns how to navigate a doctor and give their needs on their own, and so that they have privacy, because sometimes kids, even if it's not something that you might be worried about, sometimes kids don't want to worry their parents, and they won't disclose information that's very important with their parent in the room.
The number one thing I learned was that if you are willing to, talk to a teenager alone, take the time to ask the parent to leave, engage them in honest conversation, most of the time they will tell you. The other part of the time, you have to use other tests to get them to tell you. One of the things I did learn early on was that it is best to give them really kind of every chance that they can get to tell you the truth as much as possible until you take that final step for a confirmatory test, such as a urine drug test.
To help ease patients into conversations about sensitive subjects, it is recommended that you start off by asking about friendships and activities, and use open-ended questions while projecting a non-judgmental attitude. For additional information, the HEADS assessment offers a comprehensive list of these types of conversation starters. Topics include home environment, education and employment, activities with peers, drug use, sexuality, urges to commit suicide or feelings of depression, and safety from injury and violence. A link to this assessment and additional conversation starters is provided in the resources document. Motivational interviewing, or MI, is also a very useful tool for engaging patients in conversation about behavior change. Research has shown that it works and is particularly helpful with substance use, as it was originally developed to help patients with alcohol problems. MI techniques can be learned and strengthened through ongoing training, and it is recommended that clinicians complete training before applying it in their practice. A link to a motivational interviewing CME offered by NIDA is included in the resources document.
I think it's important to really have some training and understanding of motivational interviewing, because teens respond very well to that. They do not respond well when it seems like a person is taking a paternal or kind of a motherly approach to talking to them. But if it's more motivational, it's very rare to get a lot of resistance, because what you're doing is asking them, what is it you would like to address today? And is it okay if I talk today? I looked on your questionnaire and I see that you said you've tried heroin and marijuana. It's okay if we talk about that a bit more. I want to see if there's anything there that needs to be discussed. And most kids are okay with that if you address them kind of non-judgmentally and as them as the expert of themselves.